Okay, so hello there. If you guys are watching this video, obviously you can tell this is about my pinky injury that I have faced. Um, as far as therapy goes, this is actually day one of my therapy. I had a broken pinky, as you can tell, and I had two wires going through it, through my knuckle all the way to my middle of my pinky, and I just had the two wires taken out of my pinky yesterday, and I am now given this. This is what a plastic cast looks like. Hopefully this will give you guys some insight if this is what you guys are going through right now or you're going to endure this. Just to keep in mind too, right after the wires were taken out of my pinky was literally bent like this in my cast. And they literally, as you can tell, had to bend my pinky all the way up to here in this new cast. So just wanted to let you guys know, once you're in that cast where your hand's bent like this, they're going to literally take the finger and bend it all the way up here. Yeah, you're gonna probably scream. So, fair warning, take a good amount of medicine before you get those wires taken out. My wires, I would say, as far as the pain level goes, it did not hurt me here at all. I would say more likely it really killed me in the knuckle. I could feel it being pulled out of my knuckle, but not necessarily right here. I felt absolutely nothing, surprisingly. As of right now, as far as therapy goes, um, they just had me opening and closing my finger, which I'm doing right now. And I've had this cast on, just to keep in mind, like I said, only for one day. And my original cast I had on for 3 weeks. Keep in mind I'm doing that really slowly. So that is my finger. And as you can tell, it is very, very swollen. And as you can tell, it's pretty bent. I mean, it should be up like this, and literally that is all I can really do. I mean, this guy has been stuck in that cast for a while, so this is day one. Should be, like I said, as you can tell, this is pretty bad. I can wiggle it. But yeah, that's basically all I can do. So I'm just closing. They want me to close my hand, which is really, really painful. Not fun at all. And that's basically all I can do as far as bending it. And then open my hand back up. So basically that is all I'm doing right now. And it is going to be very painful. One of my friends, they did not do any therapy on their finger, and their finger ended up being stuck like this. So I have to do this 10 times, at least 4 to 6 times a day. So that is day one. Hopefully that gives you guys some sort of, thing. As you can tell, swelling in this finger is a lot. So I'm hoping, they said a centimeter this way, and then also my hand itself is a centimeter. So I'm hoping that, as you can tell here, I will get some more movement. I mean, this is all I can do for day one. At least I can move it a little bit. I got to be positive. And that's basically it. So hopefully that gives some people an insight if, this is what you are looking forward to. It's not fun. It is going to be painful. And like I said, I'm trying really hard with all my power, focusing on this finger to push it more. And it's not going down anymore. That's as good as it's going to get for now. And bringing it back up. As you can tell, it's not wanting to go up. That's all I'm getting out of that finger. So, but it's going to get better every day, they tell me. So that's as much as I can look forward to. Hopefully that gives you some insight. Like I said, opening and closing. And at least the alignment is a lot better. It was literally out here when I first broke it. It was all the way out here. Now it's perfectly straight, but like I said, I think the swelling is just what's making this extremely difficult. If I were to bend it, I can bend it a little bit down more. And ow, that's where I feel the stop. And then bending it upwards. That is as much as I can do. That is where it's pretty stiff. And as you can tell, it looks really blown up. And it's very, very stiff. I guess as of right now, my first therapy session, besides yesterday, is going to be on Monday. And I'm trying everything I possibly can to push myself because I'm probably guessing if I don't push myself, these people are going to push it for me. And that's probably going to be extremely painful. So that is my finger for you compared to this one. Like I said, these are all kind of pretty stiff and sore, but this one also, like I said, this one was stuck with this one in that type of a position. So this one definitely saw a huge difference. I can fully, almost, have it straight with the rest of them. I would say, I literally can push it back here and it won't bother it. It's just a little stiff. But this pinky, obviously, I think just because this one had surgery, it's still extremely swollen and, it's just, not really there yet, so hopefully that gives you guys an insight as far as what to look forward to your first day. I'm assuming if anyone else has wires like this, they're probably going to have to endure the same thing where it's going to be very swollen like this. And hopefully they'll have more movability than me. They said I'm very young, so hopefully I should be able to recover very quickly. My pinky bone itself is already healed. The part where I broke it, which was right here, they said that is already completely healed. And that was, I think, after 3 weeks, this bone is completely healed. Usually that takes 6 weeks. But unfortunately, I think just because, another thing is I think maybe because I'm young, it did swell up extremely bad and really got used to being in this cast. Maybe I would say maybe a little bit worse in other cases. So I think after I got the wires taken out, the doctor immediately asked me to move my pinky, and I could not, period. So for me to move it, a tad bit like this is pretty awesome. He was pretty shocked when I couldn't move it yesterday at all. So I think he thinks, he told the therapist lady that they were going to have to do a really aggressive therapy with me. So I don't know what the heck aggressive means, but if they touch my finger, I'm going to be pretty pissed. So that is all I can say about it. Hopefully that helps you guys. All right, bye.